Well, prayer is indeed good, but while calling on the gods, a man or a woman should himself or herself lend a hand. So this is a landmark article. This is where the program you're familiar with, Learning the Ropes, stems from. So this was published in 2006. And when people had cognitive training of how to use their brains better, 5 years later, their brains functioned better than the similar group of people who didn't have that cognitive training. So I put that there because this sort of cognitive training is important. So feel validated that you're sitting here today. You will be better off. So at 5 years, the trained people had less functional decline. So not only did a group of people like you think better on their test and get the right answers, because so some people, and I say in my memory clinic, I don't treat numbers, I treat human beings. So in other words, I don't really care about your test score. That's just a marker that we think is a proxy for your everyday life. What counts is the functional decline, is can you function in your everyday life? Can you cook your meals? Can you get yourself from here to there? Can you do the things you want to do? Functional decline. So not only test better, but are better. And in general, so here we go, another review article in 2013. Many studies have shown that a habit of lifelong learning, which might include practicing languages. So you're likely aware, because you come to this center here, that the Alzheimer's Society sponsors the intergenerational choir. So in addition to maybe learning French or Italian as a second language, you could learn music as a second language. So music practice or other languages, other specialized training. So if you want a second career or a second job in retirement, all of that's going to train your brain to learn new things. And the other, anyone ever heard of Norman Doidge's book, The Brain That Changes Itself? So someone, I see some nods of the head. So the term brain plasticity is an important concept that we've learned. And that was 2007. He's just come out with another book, which I haven't read yet. But the idea that it's, so what is that old expression? You can't teach an old dog new tricks. That's wrong. We can. And if we're the old dogs, there's lots we can learn and lots we can do. So, learning new things, it can remodel the brain and reshape the brain. And in the next slide, we've proven that by fancy MRI brain imaging studies for people who meditate. So they have the studies with the Dalai Lama and other researchers in that line that have looked at the Buddhist monks of how the white matter of their brain is enhanced if you have a meditation practice. How people who walk 30 minutes a day, if they're sedentary and start walking, after 6 months their brain is transformed. The tracks are different. So incrementally, by the choices you make in doing and thinking and changing your life and getting up off the couch, you can make a difference. All right, so there's lots of things to learn. Oh, and here's the meditation plug. So, and I always ask in my memory clinic, what are your hobbies and interests? Do you do volunteer work, belong to any clubs? And do you go to any churches, synagogues, or mosques? Because then that's a leverage point for me to say, you're already connected to a group. There's strength in numbers. And take advantage of the social networks you have in your own little communities. And I tell my churchgoers, well, you have a prayer life, great. You go to the service, good. And if you go to the service, tell your minister you're not coming anymore, go to the Bible study. Where the Bible study is that, what I was saying to you earlier, is the reading. You take something in and you talk and exchange. And then, if they have a disposition to meditation, and you can be an atheist and still meditate, and it'll probably work the same in your brain. May not have as much meaning, and I have more leverage. If there's some religious meaning, I'll have more likely people will buy into the activity. We know that meditation is anti-aging. So that line there, it lengthens the telomeres. The telomeres are what can be measured in our cell in terms of our cell's longevity. How many reduplicative lives, how many times can the cell double itself and regenerate do we have left in us? So we'll have longer lives if we meditate. Meditation has been shown to reduce inflammation in our bodies. It's been shown to improve memory. And it may improve memory by more than one mechanism. One might be it reduces inflammation, might slow Alzheimer's disease, and there's more and more evidence to say that. It might improve your memory because you might be less depressed. Certainly your memory will improve if you have less stress. So stress produces our stress hormones. So we will have epinephrine, which will shoot up our blood pressure. We will have cortisol. Cortisol is a stress hormone that goes right to our hippocampus, or hippocampi, they're plural. And the hippocampus is a key memory center. Chronic stress will shrink your memory center. Fortunately, that's modifiable because it will re-enhance itself if you can do your stress management. So if you meditate, it enhances brain volume. And in a study with people who already have dementia, they had patients with dementia learn a 12-minute, they listened to a tape or a CD in 2012, and this was a pilot study, so there's probably only about 12 people. So this is an example of research that's not considered very good because it's only 12 people. So we need to do more studies with this, but it was really quite positive, and I highlight it because that comment I had, you can teach old dogs new trick, and this is somebody already with established brain disease. It's not too late. And it's only 12 minutes per day that these people listened to a guided meditation, and then they did imaging before and after, and they had a control group where they had some neutral music they had to listen to. So the persons with Alzheimer's disease who meditated had less activity of negative emotions, like of the circuitry of anger and hostility and things like that. And can you put this in a pill and sell it for money? No. Are there going to be TV ads to try to sell you to buy meditation? No. No bad side effects. Oh boy. This is really complicated. And so it's a model of a teeter-totter. And this is the ApoE4 gene that increases our risk of getting Alzheimer's disease in our late 60s and 70s. So this is sort of like the example of things we can't change, like our genetics, things we can change. And you can slide where the teeter-totter tips into a course accelerating Alzheimer's disease, or by mindfulness-based interventions, you can change the base of the teeter-totter so you're not sliding so much into Alzheimer's disease. It's a model that's multifactorial. So, and this was another multiple studies that hypothesized that we have mindfulness-based interventions can reduce your blood pressure, reduce the stress hormones, regulate serotonin. So there's where serotonin is the neurotransmitter that's deficient, and we might get depressed. So it improves your mood, and we know from fancy MRI studies that it improves your brain integrity and structure of your brain. So we really need to work on that. Yeah, okay. So this was a study, again, small numbers, a pilot study. These were people. So you've heard of the term mild cognitive impairment, right? Yeah. Mm-hmm. So have you heard of SCI, subjective cognitive impairment? This is a stage before mild cognitive impairment. Well, everyone else would miss it too, because because I can't measure it. I'm trying to find these people to put into studies right now. Now, this group of researchers found like a special EEG test that can separate the people who have MCI, or they called it SCD, subjective cognitive decline. They call it SCD, but Dr. Michael Borey and I call it SCI. So subjective cognitive. These are people who they test normal, but they tell you, I'm not normal. I'm not the way I used to was. I'm working harder to do what I used to do. And then you give them the Dr. Fogarty, half day or all day long cognitive test, and they come out, well, you're normal for your age and education level. Oh, but I know I'm working harder. I know I'm different. So the fact that you know that you're different, I tell my patients, you're your own expert. You know yourself for a lot more years than I know you. So you can feel validated. You're right. So that these people are at higher risk of developing mild cognitive impairment and then later Alzheimer's disease. So we don't have the technology easily to identify this group of people. But what they did is that they had these very specialized tests which involve little probes in their brain, and that people who have this SCI it may not show up in their everyday life, but it shows up on specialized testing that their attention is different. So you might have had what they call the MoCA test. Some of you may have had a MoCA test or two. And when I say, please tap like this on the table, and you go, great, now tap only for the letter A. A. I'm going to tell you a series of letters. F, B, A, C, D, A. Okay, that is called a no-go test. So that is a test of paying attention. People with subjective cognitive impairment do a little worse on that. It's probably how fast the brains are processing all of that stimuli. When they did meditation, the people with SCI who meditated went back to normal. So, little pilot study, but it's just, I thought, really intriguing of how powerful meditation might be. Okay, I think I'm going to move it through some of the music things. There's, you're here at the Alzheimer's Society. I know the Alzheimer's Society had sponsored. Who's seen the video Alive Inside? Oh, no, you have. Yes. Oh, you have in the back of the room. Okay, Alive Inside is about an iPod project where people with Alzheimer's disease listen to their preferred music choices. And magic happens. So if you ever have the chance to watch that, every time I see it, I have to make sure I have a package of Kleenex and tissues in my pocket. Music is very powerful, and music is like a second language, and there's a lot of overlap. So when people have Alzheimer's disease, they have preferred music, there's less anxiety, there's less behavior problems, there's less agitation. So let's move on, because that's fairly well established. Let's look at people. I'm not sure what's coming up on this slide. What I want to tell you about, I'm hoping it's on the next slide, is that they took a group of people aged 65 to about 80 or 85, and these are people who have never had a music lesson in their life. And they randomized them to some had no music lessons, and they gave them piano lessons. They had to practice 5 days a week for half an hour, and they had one lesson for half an hour a week. So the people who took the music lessons, they were much smarter. They tested much higher on cognitive tests compared to the group. These are people already with dementia in long-term care, and they randomized them to a music intervention or cooking. So this was an example. I just didn't take all the studies that were positive, saying music is the best and the only. Sorry, you can do something else. So both cooking and music improves scores. These are scores that are psychological symptoms of depression or hallucinations. This is a score on anxiety and agitation. However, in this people who already had more advanced dementia, and they were very old, age 87, they had quality of life and other behavior change, but they didn't improve on a cognitive test called the Severe Impairment Battery. That was close. The P of 0.05 is significant, and it could be there's just not enough people in it. So now, I think I automatically bumped this and it went ahead. So this is another music study in Japan, where they had 65 to 84-year-olds. This was sponsored, so we have to look for bias. So the Yamaha music company paid for this study. And it was Yamaha music that they used as the intervention. And so this was one of these dual training. So in the next chapter of this talk, you'll learn how exercise helps. So now we're doing research with, what exercise with music should double the benefit, right? So that's what the point of this was. The physical exercise group with the Yamaha music had better cognitive function than just the similar exercise without the music. So their cognitive test called the mini mental state exam was better. Another test called logical memory scores were almost better. Their visual spatial, that's like clock draws and other things that are oriented in space, way better. And this was an executive function task. That's the thinking and planning and sequencing. And I forgot, that I'd never heard of. I had to ask my Dr. Fogarty about that test. That was also better. They also looked at MRI scans. Everyone's brain shrunk. So even though our brains are shrinking, and our brains do shrink with age, the good news is they work better if you give them a little exercise and music.